Hello, and thank you for joining us. I'm Noreen Jaramillo with Emergence Health Network. Now, for the next half hour, we're going to be discussing a variety of issues related to many back-to-school concerns. Whether you are a student, parent, or educator, many of the topics we'll be exploring likely impact you in one shape or form. The goal is to give you the skills needed to recognize what you or your child or student may be experiencing and know how to respond. As a local mental health authority in El Paso, Emergence Health Network, through its Texas System of Care El Paso program, have assembled a panel of behavioral health experts and others ready to share valuable information at helping you and your children. Now, one of the topics we want to discuss is school safety. In light of recent events, we decided that this particular topic will likely be on the top of many people's minds. Now, here to discuss that is our Chief Medical Officer at Emergence Health Network and psychiatrist, Dr. Marcelo Rodriguez-Chevres, along with Sergeant Danica Pedregon, training coordinator with the El Paso Independent School District. And Doctor, I want to start with you. What are some of these concerns that many could be having, especially as we head back into the classroom?
Well, we're talking about safety, and actually a lot has been said about physical safety, but there's such a thing as emotional safety.
Okay.
And were there any changes in behavior, in mood, sleep, or whatever else, even eye contact, or even actually kind of withdrawing from their social group, even family, any of those kinds of changes actually should be observed and perhaps taken to a step where you can recognize them and then see about what you can do about them. Keep in mind that stressors of any kind, and especially the kinds that we have discussed lately, brings up anxiety. And anxiety is, when you have enough anxiety, it means also that there's some neurobiological changes going on. So there could be even some autonomic type of symptom formation, palpitations or high blood pressure or sweating, or actually just, like I said before, just avoiding, withdrawing the whole situation, maybe school refusal because of fears, anger, acting out, or some people just plainly withdraw.
Okay, so keep an eye out for those signs and symptoms. Now, Sergeant, I want to move over to you, and thank you and the district for being with us to help us with, get through this and what some of those concerns are. What is the district doing to help ease some of those concerns?
So, again, like you mentioned, with recent events, the governor issued some directives, and of course, we're complying with that. We're ensuring that we continue to follow the emergency protocols we have in place. Lockdown drills, those kind of things. Now we're going to be checking perimeters, making sure all doors are locked, and that we have everybody coming in funneling through the front door. We have a locking mechanism, cameras, and then we have a visitor management system to document who's coming in and out of the campuses. So we're going to continue to do those protocols, and we also want to remind everybody that if they see something, they need to say something as well.
Okay, and you guys have actually, you're always doing training, but your collaboration with other agencies has increased as well, correct?
Correct. So just recently over the summer, we've been collaborating with outside agencies. We've done an integrated training with El Paso PD, who's putting on the class, Sheriff's Office, constables, outside small agencies, Anthony PD, Socorro PD, Socorro ISD. So it's a massive collaboration. Fire department, we have federal agencies as well, Border Patrol. We're all doing a mass response to an active shooter.
Okay.
We play the whole scenario out. We have dispatchers as well from all agencies coming in, and everybody's working together.
Perfect.
So we've been doing that kind of training.
And real quick, I wanted to talk about, and if you can do this briefly, the CIT program that now Emergence is working with you on.
Okay, so we're just finishing the last minute things to get that program started. We have CIT training for all our officers. So basically, we're kind of following what El Paso PD has done in the past. So they have CIT units, so we have CIT specialists that are assigned just to EPISD.
Nice.
So what's going to happen is that, say we have an emergency, whether it be a student, parent, staff member that's having a crisis, we can actually use our radio. We're going to call our dispatcher and go ahead and ask for a CIT specialist to go ahead and respond, and then they can come and help de-escalate the situation and then provide services after.
Thank you very much, Sergeant. We appreciate it. And real quick, Doctor, final question to you. Briefly, what do we talk to our kids about? Do we reassure them that we're okay? We have things in place. The district is doing what they need to do.
That's part of what we need to do as parents and just community members. But always to keep in mind that depending on the stage of development and age of the child,
Right.
it's the amount of information they might need to receive or not. Sometimes we go overboard, sometimes it's misinformation. Sometimes the information might be correct, but it might be an overload on the
Okay.
kid that might not be psychologically prepared to deal with that. So we have to be very cognizant of the developmental stages.
Okay, thank you very much, Doctor. And again, thank you to both of you for helping us today. Now, don't go anywhere, because in about 20 seconds, we're going to talk about the stress your children might feel with homework, testing, school in general. How can you help them? Find out when we come back. Welcome back, everyone. Now, let's face it, being a teenager can be challenging for some kids, and many different factors play a role in that. But more and more, school stress is becoming a cause. School is more demanding. There's pressure to achieve with dual credits, AP courses, GPAs, standardized testing, sports, friends, the list could go on. And there's no way to avoid stress, but how these young adults cope with that pressure and what we do as parents and teachers can make a difference. Doris Ognabeni is a school-based program manager and licensed professional counselor at EHN, and she is here with us now to talk about this particular topic. And Doris, first I want to mention that you're part of our school-based program. So real quickly, what is that?
Our school-based program, what we offer is therapy to help process trauma, caseworkers to help with coping skills, and we also have licensed chemical dependency counselors, and they help educate on substance use and why it's so hard to use.
Okay, and we're in different campuses. What campuses are those again?
Yes, we're in some EPISD campuses. We're at 5 schools, which is Franklin High, El Paso High, Austin High, Bowie High, and Canyon Hills Middle.
Okay, we wanted our parents to know that. So now we want to switch over to stress. Again, I mentioned we can't avoid it, but how we deal with it is important. What can we talk about there?
It is very important to deal with stress. It can take over your life. It can be as much as like overthinking things, having racing thoughts. Some children can have sweaty palms, upset stomach. They're going to feel that their heart is racing. All of these symptoms are super important. It can affect your health and your mental health. It could be like blood pressure, bring on anxiety. So super important to get it under control.
Okay, and I know you briefly touched on that, but what can we do to recognize when it gets to that unhealthy level?
What you want to do is you definitely want to be vigilant, be aware, go with your gut. If you notice something's a little bit off, then don't be afraid to ask questions. If you notice that your child is withdrawn, if you notice that they're easily angered, anything like that can set off those red flags.
Okay, so listen to your gut. I want to switch over to test anxiety. Now, this is a real thing. A lot of people do get that stress level when they know that they're going to do a test. So what is it that the student actually experiences?
Well, it's natural to have anxiety for tests. It's very natural. However, test anxiety is when a child experiences extreme stress during testing periods. Definitely letting them know that it's normal and it's natural, and being able to be there and have guidance and acceptance and being able to go through it.
Perfect.
Is important.
You have some tips that we can go
Yes.
through? Breathing tips are one of the tips, right, for the kids?
Yes, I have some tips, and these kind of tips are great for not just
Test anxiety,
test
but
anxiety,
stress?
but all over anxiety.
Okay.
What you want to do is breathing techniques. Breathing in and out slowly for 5 seconds each. This can help slow down the mind and the body, and this is something you could easily do at your desk. Practice mindfulness. It helps you be in the moment. You become more aware, you start to think clearly, eat a well-balanced diet, exercise, get adequate sleep. Get organized and set attainable goals. This can be just by creating priority lists. Establish a good support system. This could be a friend or a family member. Journal, draw, or paint. This can provide that emotional release of your feelings. Look for apps as reminders. There's a lot of free ones out there, and those can help you stay on track. Talk to your school counselor. They can help provide referrals.
Okay, now we want to skip ahead to the transition that some people, and we're going to have to do this one kind of quickly, but transitioning from, let's say, middle school to high school, or even elementary to middle school, that can cause anxiety, correct?
Definitely, and that is also very natural for kids to experience. A new building, a new school, new teachers. For a lot of kids, it's going to be a different teacher for each
But try and make it
class.
exciting for them.
But you want to make it exciting. Let them know it's a milestone, that they've worked really hard for this accomplishment, and it's their journey toward adulthood.
Okay, thank you very much, Doris.
You're very
we
welcome.
appreciate the advice.
Thank you so much.
Now, we also want to remind you that you could head to emergencehealthnetwork.org to access our EHN virtual relaxation room, which also has a kids corner. And there you can find those breathing techniques that Doris told us about and other stress reduction tips. Now, when we come back, we've all seen it, maybe even experienced it. Your baby is going to kindergarten or even first grade, and they don't want to go. There's crying and plenty of tears. How to help your children through the separation anxiety? Next.
At Emergence Health Network, your behavioral health is our commitment. For more than 55 years, we have been serving our community, providing mental health programs, substance use treatments, assistance for our veterans, and 24-hour crisis care.
Ideally, going to school is usually an exciting and enjoyable event for young children. But when separation anxiety is a factor, it can be stressful and even heartbreaking for both the young child and parent, and often the teachers are left to help. Well, separation anxiety is a normal part of development for all children. Having the right tools to use can help. EHN child psychiatrist Dr. Carla Alvarado joins us now to shed some light on this subject. And Dr. Alvarado, we mentioned it's normal, but knowing how to handle it helps, right?
Yes, it can definitely be very stressful for parents if they're unable to drop off the kid at school. They're having to provide a lot of accommodations, having to involve the grandparents and other neighbors or family members. So it is important for us to shed some light as to how we can help the parents.
Okay, and it's heartbreaking when your kid's crying, screaming that they don't want to go to school, right?
Yes, and it also causes a lot of negative effects in the child's cognitive and developmental milestones, right?
Okay, so we need to be aware of that. Let's talk about some tips for parents. What is it that we need to know about this and what the child's experiencing, and some tips that can help them?
Sure. So I wanted to kind of address some of the physical symptoms that children can present with when they have severe anxiety, not only separation anxiety, but just anxiety in general. So a lot of somatic complaints, a lot of headaches, stomach aches, nausea, physical pain, difficulties with sleep.
Okay.
And also it can affect their appetite.
Okay. And then we also have a list of those tips, or I guess some of those symptoms on a graphic that the audience can take a look at. How about for parents? How can we help? And you mentioned one of them is name the fear and validate their emotions. Can you talk a little about that?
Right. So I think putting a verbal phrase to the emotion is important, because a lot of the time kids, especially if they can't label their emotions, they don't know what they're experiencing. So parents need to label the emotion and model how we ourselves deal with stress. So I think that's very important. Validation is key. These children need to know that we understand what they're going through and we're here for them. One of the other things that I had mentioned that I mentioned to a lot of my families is trying to be present and be in the moment rather than thinking about future, thinking about past events.
Okay. Thank you very much. That's an important topic that I wanted to make sure that we discussed. But I also want to talk about bullying, because that's a big issue as well. Now, according to a recent report that I saw, 1 in 5 high school students reported being bullied in the school in the last year, and more than 1 in 6 were cyberbullied. And although those numbers are high, they're highest when the students are in middle school. So what can we do to help as parents and teachers? How can we help these students when we recognize that they are being bullied?
Yes, I think it's important to know that sometimes the kids won't say that they're being bullied. They can be embarrassed, or they might not want to disclose it to the parent. So if you suspect that your child is being bullied, I encourage them to open up to you, or encourage them to open up to any adult, whether it's a coach, a teacher. Definitely do not encourage fighting back. I think it's important that we encourage them to walk away, to speak to an adult. Maybe practice phrases that you can say to the bully if it happens. Practice that at home. Visiting bullying websites, that can be very helpful. Encouraging the child to travel with their friends so they're not alone, because bullies tend to target those children that are alone.
Got it.
And then also talking to the school to see if there's other programs that other schools have to anti-bullying that we can implement in that school.
Okay. Now, you kind of addressed this, but do you have any other advice to help the student help themselves? Obviously, talking to someone, but how do they go through a drill? Do they go through in their mind how they would talk to this bully?
I think that's where practicing at home, what can we say to the bully, comes into play. It's harder for middle school and high schoolers because a lot of the times telling the coach and the teacher, they don't want to do that. So I think practicing what you're going to say to the bully is going to be important, and knowing who to reach out to when the time comes.
Okay, and real quick, I want to pull up a graphic about some of the consequences for individuals who are bullied. There's physical injury, social and emotional distress, self-harm, even death, and it also increases the risk for depression, anxiety, sleep difficulties, lower academic achievement, and even dropping out of school. And what I found was interesting with this is the bullying consequences for the youth who actually do the bullying, and that is youth who bully others are at increased risk of substance misuse, academic problems, and experiencing violence later in life. And bullying themselves, they often suffered bullying as well. So there's consequences for everyone involved, correct?
Right, and I think when the bullying attacks those that, in regards to their religions, their sexual orientation, or their ethnicity, that can be very hard to manage.
Okay. Well, Doctor, thank you very much. We really appreciate the valuable information that you've shared with us.
Thank you.
All righty. So I also want to point out that on your screen you are seeing a QR code. At any time you can take your phone and scan that code to access a list of local community resources to help you and your children. Next, we're going to talk about teenage substance use, what you need to know when we return. Well, as children grow, parents have more to worry about. And one of those concerns with risky behaviors is substance use. In fact, substance use by teens can have a big impact on their health and well-being. Some of the risks include affecting the growth and development of teens, especially brain development. Substance use occurs more frequently with other risky behaviors, such as unprotected sex and dangerous driving. The earlier teens start using substances, the greater their chances of continuing to use substances and developing substance use problems, such as addiction, later on in life. Substance and alcohol abuse among teens can be a risk factor for suicidal behavior. Dr. Wayne Thornburg, EHN Chief Medical Officer, is here with us now to tackle this issue. He specializes in substance use disorders, and I know one of the trends that we wanted to talk about, Doctor, is the use of vaping. That's the trend between adults and teens. Can you talk about some of the risks and the consequences with that?
Well, with any substance use, whether it's vaping, alcohol, or drugs, it doesn't really make any difference. We know that the brain continues to grow and develop till about the age of 25. And with that comes, you know, the possibilities of some adverse outcomes. We don't have the luxury of looking at a brain at an earlier age and one later until we see the personality develop at the age of 25. We just assume that the personality that we see at that point is the one that would have developed from the age of 15. But with any of the drugs that are out there, it does hinder and alter the growth and development of the brain.
Okay. So as a parent, and even as a kid, they need to know that the decisions they're making now could have consequences.
Absolutely. One of the most important things that parents need to realize is that they need to keep the lines of communication open with kids. That's really, really important. In today's society of social media and kids and activities and things that are ongoing, there seems to be an ideology or a tendency to let someone else kind of take on the responsibility or be a part of that leadership role. And with parents not engaging in that, there seems to be a lack of being aware of changes that are occurring in kids and being able to bring to their attention maybe the need for any particular services due to their substance abuse.
Okay. Now, I wanted to share a statistic that I had read, and it's 90% of teens who are suicidal have a substance use disorder, including alcohol use. Now, to me, that's alarming. I didn't realize it was that high. But what do we need to be on the lookout in regards to that relationship?
Well, it is true. About 80% of the patients who use substances have an underlying behavioral health problem. And as kids start at an earlier age, they tend to have a tendency sometimes to start out as an experimental basis, but then they realize maybe with poor coping skills or poor relationships that they use this as kind of soothing them a little bit better. So in the process of that, and they get a little bit older, they have a tendency to develop maybe more advanced substance abuse problems, advancing behavioral health related problems, and even comorbidities, medical problems that go along with that. Taking that into consideration, what you were discussing is that sometimes the inhibitions that are released from the alcohol and drugs, if the kid has poor coping skills, sometimes the what they think is a resolution to their problems has adverse outcomes.
Okay. So on a final note, what is the most important message that we need to take away from this discussion, both as parents, teachers, students?
Be aware and monitor what your kids are doing. That's really important. Changes in mood, behavior, isolating themselves, changes in their friends, activities, all of those sorts of things are things that as a parent we need to be watching and monitoring our kids for. If we see those changes, it's important that we maybe address it with the child at that point, and if there's still continuing problems that we see, is that reach out for resources and services that might be available to help them.
Okay. Thank you, Dr.
You
Thornburg.
bet.
I really appreciate it.
Thank you.
Well, we're going to take a little break. So far, we've tackled a lot of important topics, but when we come back, a topic that could be the difference between life and death.
At Emergence Health Network, your behavioral health is our commitment. For more than 55 years, we have been serving our community, providing mental health programs, substance use treatments, assistance for our veterans, and 24-hour crisis care.
Welcome back, everyone. Now, as we get ready to wrap up our special on back-to-school mental wellness, we want to spend some time on suicide prevention. Suicide is the second leading cause of death for young people between the ages of 10 and 24. Sometimes for them, it could feel as though their feeling and their struggle is underestimated, but it doesn't have to be that way. Emergence Health Network recently partnered with students at El Paso High School to create this important message.
Did you know half of all mental health conditions start by age 14, but most go untreated?
And did you know that suicide is the second leading cause of death among teens?
It doesn't have to be this way. Together, we can be the difference.
It can be super scary when someone you know is having thoughts of suicide, but recognizing when they're having challenging emotions and certain behaviors is super important.
Are they withdrawing from friends, family, and activities? Maybe they're giving away personal belongings.
Maybe they're experiencing dramatic changes in their mood, or they are being reckless. Are they increasing drug or alcohol use?
Did you know substance and alcohol abuse among teens is a risk factor for suicidal behaviors?
Maybe they're having serious changes in their life that they're scared to talk about, or maybe they're feeling depressed and overwhelmed.
You know, life can be stressful for teenagers. We want you to ask us what's going on in our lives. We want your help.
We may not say those words, but that's how we feel. We don't want to feel alone. We want to know that someone cares.
So please, speak out. Ask us how we're doing.
Talking about suicidal thoughts and feelings with the right person can help a lot.
And it's our responsibility as students, teachers, friends, and family to be there.
We can be a lifeline. We can be the difference.
Joining us now is Andres Arvizo. He is with our crisis intervention team at Emergence Health Network. And Andres, how important is that message that those high school kids created? And what I took away from it was that they wanted people to ask them how they're feeling.
I think it is a very important message to the entire community. I work for the crisis intervention team, in which many people see us as first responders. But in reality, after watching this video, it makes me realize that we all can be first responders, and actually, especially assisting somebody in a crisis. I'm glad that students actually want to be heard, but more than anything, they want to be understood and not judged.
Okay, and it's important, even though that conversation is intimidating, for us to check in on them, right?
Yes. Correct.
How do we approach someone if we think that they might be thinking about suicide?
And the first thing is always look for safety, of course, especially on any situation. We have to make sure that we're in a safe place, but also the person that we're talking is in a safe place. We have to make sure that if we think or suspect that the person is thinking about suicide, the first thing is not leave that person alone.
Okay.
Advise 911 immediately to get assistance right away. A lot of people are afraid of calling 911, but in cases like this, we have to treat it as an emergency.
Okay.
Now, another thing is involve support systems. So either parents, family, teachers, any friends that can actually support you while the assistance is in their way.
Okay.
We're about to launch actually a CIT unit with El Paso Independent School District, which we're looking forward to, and that will be an additional assistance.
Okay.
Now, another thing is always talk to the person and find out what's going on in their life that is making them think about suicide.
Okay.
We will see that most of the time there's underlying issues such as trauma, depression, anxiety, and many other illnesses that can actually affect the student's state of mind.
Okay, now we actually have some warning signs that we could talk about. Can we go through that list real quick?
Yes, ma'am.
Okay, so we have, first of all, reckless behavior. If you notice an individual is having that reckless behavior, and some of the other tips that you have?
It's increasing alcohol or drug use, giving away personal belongings, making threats to hurt oneself, withdrawing from friends, family, or activities, feeling hopeless, worthless, trapped, or lack of purpose, dramatic changes in mood, previous suicide attempts, and actually the opposite, which is isolation.
Okay, got it. Okay, Andres, thank you very much. Very valuable information. We appreciate it.
Thank you for the
Well, we want to thank Andreas and our other panel members, and most importantly, we want to thank you for spending this time with us. We hope that you gathered valuable information to help you as a parent, educator, and student. Now remember, help is available, whether it's at Emergence Health Network or numerous other local providers in our community. The key is to talk about mental health and seek help if you need it, because it can work. Thank you, and have a good night.